Now the next model is called, generally speaking, network model. I am also not very clear on it yet. This is kind of newer model. At the end of the session, you can pick up some of the brochures. We have another network model that is called Compassionate Care Network from Chicago. And this is a different network model called MINDS, which Dr. Kaissi would cover. I really want to myself understand and pay attention to this model. This is a very unique and very interesting model that some of our communities may be better used than the other models. Dr. Kaissi.
Assalamu alaikum. First of all, I would like to thank Imana for inviting us, and Jazakumullah khair for attending our session. So, MINDS, Medical Network Devoted Service, was co-founded over a year ago by Dr. Taif Kaissi, who's a neurologist, and Brother Iyad, who has an MBA in healthcare, and myself in the LA area, where we thought about what can we do to provide people with free healthcare, and how can we do it in the most efficient way. And also, we want to focus on specialty healthcare. One side we have Ummah Clinic, and on the other side we have Al Shifa Clinic, and we sit in the middle. And we are always, as partners with them, we are always in communication with them, and we are always helping each other. So it's not a competition between any of us, it's more of an association, a work that is related to each other, to complement each other. So a few of the things that we're going to cover on our agenda today is who is MIND, our leadership, what is our healthcare vision, and what's our healthcare mission, our core values, some of the core services that we're providing, why MINDS, and our affiliated partners, some of our past events, milestones, and summary. And then we'll open it for Q&A, inshallah. So as I said earlier, MINDS was established in 2011 as a community development economic empowerment programs. That's one of the branches that we have at MINDS. The second branch is our charitable specialty healthcare, and then our mental health initiative in faith-based communities. And we really are focusing on the Muslim community on this one. As myself, I sit on the Clergy Advisory Board for the Los Angeles Department of Mental Health and the Steering Committee of the State of California on the Spirituality and Mental Health Initiative as well. So our executive leadership board is Dr. Taif Kaissi, who is the president, myself, the vice president and executive director, Brother Iyad Afalka, who is an executive board member, Suhail Mirza, Erim Chowsky, who is a MFT and also a executive board member. Our healthcare vision is to become the leading network in providing health conditions, improving health conditions by making healthcare services accessible for the uninsured and underinsured, regardless of age, gender, race, ethnicity, or religion. Our mission is to serve the healthcare needs of the underinsured and the uninsured by providing direct specialty care within patient locations, regardless of their ability to pay. So for us, is one of the biggest goals that we focus on is that we don't want our patients to travel from one place to another. If they are in one part of LA and they had to go all the way to the other side, we don't want to do that for them. Or they had to come all the way to the other side of Inland Empire, for those who are familiar with that area. I mean, LA is pretty large, so it's quite a bit of traffic, quite a bit of distance from one area to another, looking about an hour and a half or so. So for us, what we do is we find a specialist who will treat that patient within their geographical area, within where they live, as very close. We try to make it a 10 to 15 minute trip for those patients. They get to go to the specialist clinic. For our participating physicians, we create a platform of healthcare professionals that network and stay informed about the changes in the healthcare policies, and also on the local and the national level. So our core values, A is the community is the center, that's where our focus, and when we say community, we do not only mean the Muslim community, but we are actually providing it to all the communities. And so is our physicians. They come from every ethnical and religious background, and our patients come from every ethnical and religious background. So our biggest focus is the dignity of the patients. Some patients do feel uncomfortable about going to free healthcare clinics because that, they feel like there's a stigma associated with it, or they're uncomfortable going there because of the long waiting. They don't want to do that. So we work hard on preserving that dignity by sending the patients to the actual physician office that we have contracts with, a memo of understanding between us, and we agreed with those physicians on how many patients per month or per quarter, per year, whatever they're comfortable with, on how many patients they're going to see for us. And then all the patients call in to me. I triage those patients, find them the specialist where they live, we refer them over to the specialist, and they receive the free healthcare from that particular specialist. Responsibility, compassion, comfort, impact, and excellence. Those are our core values. In excellence, I can honestly tell you, our patients who used to have insurance, who lost their insurance, who had PPOs, came back to us and gave us feedbacks that they said, honestly, this is the best healthcare we've received from the physicians. We were treated with so much respect. We were given all the time we needed. We left there feeling comfortable, knowing that we were in the best hands available. Our core services is the specialty office consultation, where specialists are seeing the patients in their respective office. So every patient has an access to see a specialist in their respective office. They don't have to travel far, nor do we impose on the physicians themselves to volunteering and going to a free healthcare facility. Therefore, they can give us back because A, the patient is scheduled within their normal working hour schedules, and B, we're saving the time for traffic and all that. Laboratory work, we do have actually access to lab work. And because of the state of California regulations, there is a minimum charge because everybody for the state of California has to pay at least the minimum rate of Medicaid, the Medicaid, which is Medi-Cal in the state of California. But we have a memo of understanding between us and the lab work that we go ahead and take care of these things if our patients absolutely cannot afford it. Diagnostic testing, alhamdulillah, we are blessed where we can actually say we provide free 100% diagnostic testing. That's include X-ray, MRI, CTs with and without contrast, including ultrasounds, anything that we need from the facilities, we're actually getting it, alhamdulillah, shukr, for free. Echocardiograms for our cardiologists, we get those for free. Nerve conduction studies, EMGs, ECGs, all these, alhamdulillah, shukr, we're getting for free. We also provide free dental care and free mental health care to those who need it. Why Minds? Alhamdulillah, shukr, as I said earlier, we provide the access to the physicians within 1 to 2 weeks maximum. And alhamdulillah, shukr, we have not had a single no-show ratio. And we're very proud to say that, where our physicians, when they are committing their service, our patients are going to them. They're not saying, okay, well, just because it's a free service, I'm not going to go, or I changed my mind, I cannot go today, and I'll go ahead and go on a different day. We have not had that, alhamdulillah, shukr. We've had one person who requested to cancel. He actually called at 6 o'clock in the morning on a Saturday because he had to leave town on the day of his schedule. And he called, left a message saying, I'm sorry, I will not make it. Please cancel my schedule. We work with different communities, and alhamdulillah, shukr, we're providing the service to them. It's a comprehensive specialty care. We provide cardiology, dermatology, endocrinology, family medicine, gastroenterology, internal medicine, neurology, OB/GYN, oncology, orthopedic, pediatric endocrinology, psychiatry and psychology, radiation oncology, rheumatology, and neurology. These are the specialists that, alhamdulillah, shukr, are providing the health services that we reach out to them and we send our patients to them. Some of our partners is the private physicians that are our partners. The AMHP, alhamdulillah, shukr, we have a strong relationship with them. Kids Come First is an organization in California where they provide free health care or Medicaid rates to the children who are, need of services. However, when those children need specialists to see, Kids Come First calls us, we find them the specialist, and their patients are seen at absolutely no charge. Outreach Nation is another facility that's in the state of California. NAMI Pomona, which is the National Alliance on Mental Illness, we have a strong partnership with them, where, alhamdulillah, shukr, through them and with them, we are providing free mental health services, including certification on mental health first aid in our local masajid. where we combine together our efforts. We put a lecture, we put training, and we certify. And we are working with 3 masajids in the area to establish an ongoing mental health training to the community, to the imams, and inshallah our goal is to increase and empower the community, the Muslim community, to reduce the stigma and to understand what's mental health and what can be done about it and what are the resources available for mental health. And alhamdulillah, shukr, we've been on the mental health train over a year. Since approximately May of 2011 is when we joined hands with the Los Angeles Department of Mental Health and with the Steering Committee on Mental Health and Spirituality in the state of California, and we've been very effective, alhamdulillah, shukran, bringing the Muslim voice into the table. Tri-City Mental Health is another facility in our area, which is the largest in the state, providing free mental health services to those who need it. Fresh Start Ministries, Boys Republic, Los Angeles County Department of Mental Health, San Bernardino Specialty Care Coalition. We actually got approached by the county of San Bernardino, and they asked us about our model. We joined hands with them, and they are looking into our model to implement it across the county with our assistance in order to assist the county hospital, because the county hospital of San Bernardino has approximately at this time over 16 months waiting list to see a neurologist, over 2 years waiting list to be seen by an ENT specialist, and alhamdulillah shukr, we can provide these two particularly, I can say within approximately a week, and for neurology we can literally provide it within a day or 2 notice. The Pacific Clinics, which is also another mental health institute that we work with, the Garfield Neighborhood Center, where we actually focusing on economic empowerment, and that's one of the things, as Brother Altaf said, you don't want to just keep giving, you want to also solve the issue. And that's one thing we are focusing on as well, alhamdulillah shukr, and that is by providing new and developing new programs to the community to empower those who live there, such as the Community Garden Center, as well as other programs that we are working with to empower the community in the sense of what can they do to lift up themselves, from education, from training, from going back and being able to do stuff for themselves, as well as to all these areas that we talked about, such as Mount Baldy and the Shifa Clinic, our partnership with them. But for Mount Baldy Church, that's one of the areas that is up in the mountain by themselves. We actually go and provide flu shots for them when the season comes. We've provided flu shots so far in the year 2011, approximately 500 patients. So alhamdulillah shukr, we're constantly reaching out, we're constantly being approached and asked for services, and we are always there to help. Some of our past events, we were at National Association County and City Health officials, where it was actually from the HHS people came over here, and alhamdulillah shukr, we got to see them when they visited us. They came to Los Angeles, and we had a great talk, lengthy progress with them. And in June, we actually gave a talk, a presentation at the 11th Annual Conference on Mental Health and Spirituality, which was hosted by the Los Angeles Department of Mental Health, and we presented Islam, spirituality, and mental illness, which was an education not only to the consumer, but it was also an education to the physician, to the psychiatrist who wanted to know more on how to deal with Muslim patients who need assistance on the mental health. And we attended conferences in Chicago, alhamdulillah shukr, we got to reunite with my brother, and other milestones that you can see that we've done, such as food distribution, such as iftar in the community, where we just had an iftar community dinner at the city of Pomona at the Garfield Neighborhood Center to honor the community. We did it also last year, where we had a celebrity chef come over and cook for the neighbors and for all the community, and we served them, alhamdulillah shukr. We've done multiple healthcare events, and our most recent one, we were in partnership with the Humanitarian Day for 2012. We do these throughout the month of Ramadan, and we usually do it in 2 or 3 different locations. This past year we did one in Pomona and one in Santa Ana. Both are within the LA area, and alhamdulillah shukr, we've actually served over 1,400 patients through these mental health, through these free health screenings. Some of our past events, as I said, the Islam and Spirituality Mental Health at the Los Angeles Department of Mental Health, San Bernardino Special Care Quality Coalition, where they invited us, Brother Ayar was presenting, and the Los Angeles Human Relations Commission, Ramadan Iftar in 2012, we were invited. That's me with Sheriff Lee Baca, the Orange County, Los Angeles County Sheriff. Alhamdulillah shukr for being a one-year only organization. We've already been recognized by the U.S. Department of State, where we received a certificate from them of appreciation for assisting some of their patients, some of their students that are brought into the country where we've served them. And we continue to have that relationship with them, alhamdulillah shukr. Like I said, our milestones, I don't need to go over all of them. So, here's some of them. We just mentioned, but just to hit a highlight, alhamdulillah shukr, we actually have served over 95 patients within this past few months. We've provided healthcare to over 110,000 of free healthcare. We actually have had patients who are in need of medication. Some of their medications are for MS, a patient who used to have insurance, lost her insurance, and she needs to continue for her medication for MS. Her medication costs approximately $3,500 a month. We provide that for them at absolutely no charge every single month, alhamdulillah shukr. We actually had a patient who came up, and was talking about what she can do because she was about to lose her home. Her home's about to be foreclosed, and I asked her why. And she said, okay, it's healthcare for me and my family, approximately $600 a month. I can't afford to pay for my mortgage payment. And I said, okay, you have mines over here. You can reach to us. We'll provide for you the healthcare and your family at any time. Let us know. Here's my card. You can cancel your healthcare insurance, add that money to your mortgage, and save your home. And alhamdulillah shukr, she actually did that. She's a non-Muslim patient, and she managed to stay in her house, knowing that there's a safety that she can reach out to us at any time. And the phone number for us will actually ring always at my cell phone. So they're 24/7 have access to us. We actually have also started our own intern program where every quarter we are having 5 interns, and we are doing different programs with our interns, alhamdulillah shukr, to help them serve the community, help them with their education, with their goals, where they would like to go ahead and reach out as well. So in summary, MINDS is a community development organization which focuses on enhancing healthcare access for the underprivileged, uninsured, and community service driven toward addressing the poverty and economic challenged neighborhood. And our goal is to serve, to assist humans regardless of what's their background, what's their religion, because alhamdulillah shukr, as Muslims, we need to be the best example. And Allah has given us knowledge, and it is time for us to share, reach out to these people. Here is a story that was on CNN last night, and I just would like you all to take a look at it, think about, could we actually have made a difference? Leslie Elder, she was unaware of all the health services that she could have received. And she, quote, said, "I honestly don't know how much more I can endure." She writes earlier this year in Facebook message to her friend, "I am fighting for Medicaid and disability. I can't work. I sit in bed. I cry a lot. I'm still fighting for healthcare and still fighting for closure. I'm also upset, but perhaps it was not meant to be. I don't know anything anymore," said Elder, who died in July at the age of 63, without any insurance coverage. She died from cancer. To me, these are honestly very touching stories, because had our communities been powerful in the sense of reaching out and providing healthcare services to those such as Miss Elder, Allahu A'lam, she could have been alive, as we say, Al-A'mar biyadillah, Allah only is the one who handles, life and death. But there are people every single day who are walking around throughout the United States who needs access to medical health care. And I believe that it is our responsibility to bring out our organizations to the light and let people have access to us and provide them with the best health care that is possibly can be provided to human at this time. Jazakumullah khair. If any question, anybody has anything, please let us know. We'll be happy to assist.
How long you guys in existence?
Over a year.
And how many patients you have seen?
We've seen over 130 patients. This from January till now, we've seen approximately 95 patients.
And how many Muslims and how many non-Muslims?
I would say approximately 10 to 15% Muslims, and the rest are non-Muslims.
And let's say if a specialty care physician they tell you that they are signing up for this number of patient visits, and then you coordinate those, or how does it work?
Let's take, for example, OBGYN. I actually went to the physician after we talked, and he said, I'll see 20 patients for you a month.
So 20 patient visits.
20 patient visits per month. So,
Be one patient with 20 visits.
no, it's 20 patients. But we always let them know. In the event that there is a follow-up, please do let us know. Therefore, we will reduce the number of referrals for them the following month. We don't want to, put a burden on these physicians. They are all, alhamdulillah, shukr, willing to help, willing to assist. So our goal as the control of the patients on, literally we're funneling on who's going to go to which directions and how many every physician is going to see. Our role is to provide the physicians themselves the comfort in knowing that they're going to see what we originally agreed on.
And you guys give them a card like CCN that identifies them?
No, we don't give a card like CCN. Our patients walk in with our referral letter, which has our letterhead on it. It's a colored page that they take with them to the physician. A copy of that letter had already been faxed to the physician office, and it's usually they go in as soon as they present themselves, on the schedule they are seen. And honestly, our patients are, they're treated with so much respect and dignity that only the office manager, our main contact, and the physician himself know who are these patients who are not going to be charged. So they just go in, and their EMRs are always, they have the word minds as in their insurance, and they are seen, treated, and they leave.
One of the things also we do to eliminate waste and to meet the expectations of the physicians, we use an online EMR where the physicians, they fill in the information of the patient so that we keep track of what's going on. So let's say the physician doesn't have the time to do that, they fill out everything on paper, they give it to us, and we have a healthcare provider or a nurse to enter in the EMR. So this way, if the patient switch doctors, they didn't have to start from scratch. There's some medical records for them.
And the physician does bill them?
Excuse me. Let him say, because we are video recording, it won't be effective. Can you please repeat that?
Sure. What Brother Iyad was saying, who is actually one of the executive board members of Minds, is that our patients, all of their medical records are stored in online EMR, electronic medical records. So if they go from one physician to another, let's say today they're being seen for rheumatology, and then the rheumatologist says, you know what, I need them to actually see now a neurologist. The next treating physician can just go in and have access to all of their past medical history, see what they've been treated for, what was the previous diagnosis, now why they're being referred to. And no, our physicians do not bill the patients. Our patients are not billed. Our patients are seen at absolutely 100% free of cost. All right, Jazakumullah khair. Thank you so much.
Thank you, Dr. Kaissi, for that explaining that model. I'm sure a lot more questions need to be answered, but this is just the process. This is just the beginning. Inshallah, we will hold such forums and continue this discussion, because it's a huge, vast area we all need to understand and see what works best for us. With that, I thank you, everybody.